Today on Weekend Business Report, how a major healthcare provider and a nonprofit are working together to beat hunger and poverty.
Welcome to Weekend Business Report. I'm Ileana Bravo. We all know that children who eat healthy and exercise do better in school and in life in general. But in some inner city communities, poor nutrition, coupled with gangs, drugs, and poverty, have burdened the children with a big disadvantage. We visited a grassroots organization that's helping to change that, along with support from major corporations. This is the Englewood neighborhood on Chicago's South Side. It is an area riddled with crime, drugs, poverty, and murder. It is an area of just about 3 square miles. 42% of the households are below the poverty line, and the per capita income is just under $12,000 per year. This is not a neighborhood where you want to be alone at night.
Nothing for the children to do. You have a lot of children not attending school. No place for them to go.
Charlene Woodson is a single mom. Her husband left her. She's raising 3 children on her own, and she's been battling emphysema for years, which has resulted in her inability to work.
It's very difficult. I try and do what I can with my children. My health has failed me, but I'm still trying.
Adding to that difficulty is the lack of availability of nutritious and healthy food.
When you drive through the neighborhood, you really see that there are 2 food options. There are corner stores, which are often liquor stores, and actually there's one option pretty much. There's the corner store.
Food deserts mean that you have to go an inordinate distance in order to buy healthy food. And so there's been, in Chicago, it's kind of notorious for that, especially in certain neighborhoods.
One of the consequences of poor nutrition associated with a food desert is an increase in childhood obesity.
If you don't have enough calories, then you're going to be a little listless sometimes. You'll sleep a little bit more. You're going to have a commensurate decreased performance in school.
And after school, the challenges continue.
There's not enough programming or people that's too concerned with teaching kids how to socialize with one another, how to work together with one another.
Michael Riddle, or Hollywood as he's known in the community, knows firsthand the challenges facing the youth here. He grew up in Englewood and still lives here. He's also a community activist and a mentor.
When I talk to a lot of these kids, it's low self-esteem. You know, a lot of them feel like they don't have the support. They know their mother's gonna love them. They know their mother's gonna try to provide for them and struggle at it. But at the same time, it's that male role model from a father that they truly need to give them that push to be successful, because a lot of kids seems like they really don't believe in themselves. And it's a father that's missing out of most of these homes.
With all the stress that comes with that, it is difficult for the parents to contend with the challenges that they face. And therefore, it requires some extra hands to come and help the children.
Tony Lumu is the founder of Englewood-based Community Outreach Volunteers, or COV. Their mission is to help residents create opportunities to develop their abilities and skills in order to overcome the barriers they face.
Community outreach volunteers come in to be part of that, to be part of the solution, to try to provide the services to the children so that the children have alternatives. Instead of being in the streets and be involved into the gangs, we are mentoring them, we are tutoring them, we are giving them educational knowledge that they need, and we are involving them in activities that helps them to develop and also to fight other challenges.
That involvement takes the form of programming directed at children and their families. COV has programs to give children access to computers, classes in finance for their parents, and cooking and nutrition classes for adults and kids. Additionally, COV provides extensive programming in the schools to help teach nutrition by providing healthy snacks and mentoring.
Stress nutrition, because we need to start that early childhood. You start as soon as they walk in the door. It's very important. They know what balanced diet is. If you see fruit and vegetables and you see some semblance of, I felt good after I ate, I can get started with my day. I think that changes things quite a bit for children coming into the building.
And when you look at our children, you will notice that they look healthy. Part of it is because of the training that we have given to them over time.
COV also provides extracurricular programming that allows the kids to get their hands dirty at a community farm right here in Englewood.
The most, I think, exciting thing that we do is bring food to a food desert. So we grow on a little less than 0.8 of an acre, so a pretty small space. And this year we expect to grow 35,000 pounds of food.
The urban farm is awesome. You know, to see it and see it grow over a period of time, I think that's very, very good.
As in any well-rounded program, nutrition is only part of the equation.
We basically get the kids to work out, exercise, run, and just keep them active. That's the most important part, because a lot of kids sit down, play video games all day, but we get them out of the house and into the field and into the parks. And what that does, it allows them to also meet other kids who are trying to do the same thing.
Charlene Woodson's son is one of the children that has been actively involved in sports with Hollywood and COV.
I play football, basketball, I run track, I play baseball. I recently got the yellow ones, the gold ones from my school for sports. These are from COV, Hollywood. He's a good coach. He keeps us busy. It keeps me off the streets, off the corners. This can keep me focused.
And that focus extends to academics as well. COV's volunteers offer after-school mentoring, computer labs, and homework help, and the results are real.
Those students that remained in the COV program, the Community Outreach Volunteers Program, the longest, and that stayed at Bass School, we saw them moving forward and being on track for graduation as well.
Community Outreach Volunteers is truly a grassroots organization. Additionally, grants help. LISC Chicago is one of the first grantors to COV.
The results have been phenomenal. So since our initial investment in 2009, we've seen the program grow exponentially in the neighborhood. And we see over the years, not only have the youth continued to come back, but they are contributing to the programs themselves.
And recently, the community came together to support COV as they competed for a $30,000 award in Aetna's Voices of Health competition, an outgrowth of their support for the Martin Luther King Memorial.
We are proud to be the supporter of the Martin Luther King Memorial in Washington, D.C. We thought it was important for us to support that initiative because Martin Luther King stood for equality for all. Aetna is a strong believer in equality of health care for all. And so it made very, very much sense for us to be a part of that initiative.
So we created Voices of Health to target local nonprofits that are working to address needs in their communities. And these needs all center around closing the racial and ethnic equality healthcare gap.
Community Outreach Volunteers is a perfect candidate for the Voices of Health program. When we take a step back, right, we look at the south side of Chicago. Folks living there are facing a number of challenges. And what's great about Community Outreach Volunteers is that they are undeterred by those challenges. So they are committed to providing the help necessary.
So there were 34 nonprofit organizations that were nominated this year under the Aetna Voices of Health umbrella. And they were chosen based on their size, scope, and certain criteria that we follow.
Then we asked America to vote. Business leaders, community leaders, thought leaders, sponsors, supporters of the organizations, all turned out to vote for their favorite organization.
And in the end, there was one winner, Community Outreach Volunteers, because they are working to build a healthier world for all of us here.
Well, Aetna's award is very, very important. Not just the award, but the fact that a corporation like Aetna is willing to come in and give us a chance to be effective in the community is great. It says a lot to us. I've seen lives being touched. Not on a scale that we would like to, but we celebrate small victories. If we can affect one life, 2, 3 lives, we count that as a victory.
COV is taking quality time out dealing with these children and showing them things that ordinarily they wouldn't even have access to in the inner city. And you can just see it in the children. Their talk even becomes different. You know, and they take that home with them, they tell it to the students, and what he's actually doing is making them better people. They're gonna grow up nurtured and having a mindset that I can achieve something.
I think this program, Sylvie, has been a lifesaver to myself and my children, because the streets could have had them. But being in this program, doing something positive, it kept their mind away from the negativeness. And as a single parent, I'm grateful and I'm thankful.
In a nutshell, when you look at the award that we are getting from Aetna, is a award that is really at the end of the day is going to impact lives over time, because the recipients and the programs which we are supporting will not stop. They will continue and continue. Even when COV is gone, the skills that we are giving to the children will not end.